Representative Burris, you recognize.
Thank you, Mr. Speaker. I just spent about 3 hours in public health with about a third of it debating bed bugs and mattresses. And it's like everybody knew that. We passed over all the bills. I didn't have a lot of time to refresh or get my mind off bed bugs. So hopefully I won't stray during what I hope to be a short presentation. This is the bill that we all knew was coming. It's the bill we had a committee of the whole about on Monday. It's House Bill 1143. There's a companion bill, and that's Senate Bill 1020 that we'll also vote on later today. This is the Healthcare Independence Act. I hope all of you have had a chance to read it, discuss it, ask any questions that you have. I was thinking, the one thought I did have time to have before I came down was I wanted to say that I know how high tensions are, and I know how the stress that everybody's under, and that's something that I can't do. I can't do anything about that. Nobody else can. But I think all you can do is, I wanted to say to at least maybe take a moment and enjoy the positive aspect of that stress, and that's that if you look around the room, there's only 100 of us in here because there's only 100 seats. We're all here because we ask people to come to Little Rock and make decisions for them, the best decisions that would impact their lives. And we're going to disagree on what that decision is, but we ought to at least take a moment and step back and appreciate the fact that people trusted us and sent us here, and that I think everybody in this room has taken put a lot of time and a lot of effort into making the best decision they can. And even though we disagree, that needs to be stated and appreciated. And I appreciate all the input that all of you have had in the discussion. I don't want to spend too much time on the particulars because we did that, and I have a feeling that a lot of the particulars we'll discuss in the debate because I assume there's going to be people speak against this. I wanted to touch briefly on it. I wanted to say that, two things. I understand all the concerns, because this is a conclusion, supporting this bill was a conclusion that it took me a little bit to arrive at. We run the easy bills in January. The tough one run in April. There's a reason why we're running it now, and it's because it took all of us and me a long time to reach a decision, and some of you may not have arrived at one yet. But I understand the reasons for concern. We'll talk about it in the debate, but I don't want to minimize the opposition because there's people that I agree with 9 out of 10 times that are going to disagree with me on this one, and nobody should ever portray this as black and white. But here's what the concern, or here's some of the particulars. I mean, there's a lot of concerns about the cost. All I can say are about the framework and the trust issue, frankly, with HHS. I'll say that if you read the bill, I don't think it could be written any stronger. I don't think we could provide ourselves any more protections against an ever-changing federal bureaucracy or federal government. Because in the bill, everything is listed exactly what we've asked for, and if we don't get it, the act isn't implemented. It doesn't get any simpler than that. For those that argue wait, I would say that there's probably more harm in waiting, because by passing something now, all we did was put every one of our demands into a bill and said, give them to us or this act isn't implemented. That's not negotiation. That's demands. And since we get to be the ones to make the demands, I'm okay with writing the bill that way. There's protections, and the state's protected. I would say that it's also further protected from the fear of what changes might come potentially 3 or 4 or 5 years down the road. And this goes to the next point, which is the cost of doing nothing. And the fact that if we choose to do nothing, we've got a Medicaid program that totals over 900,000 Arkansans in the coming years. It's proven unsustainable with hundreds of millions of dollars of deficits every year. If you're a person like me that believes that eventually the house of cards is going to crumble, the house of cards being the federal government or the deficit in the budget, and they're going to have to get serious about it, then we're better served by having as many people out of Medicaid and onto an exchange as possible, because as I quoted the other day from another writer, that exchanges are reformable in a way that Medicaid is not. And it's very important to say that these aren't just on the exchange will not just be populations of people that could be on Medicaid today or below that 100% marker. They're people that we offer services to through an Arkansas Health Networks, through family planning for pregnant women. They're people that we can't take those services away in Medicaid today, but by putting them on the exchange, we free the state from that obligation. So even if there's changes, we've got a lower, even if there's changes from the federal government, we have a lower obligation when that happens than we do today. So if you're afraid of that anvil falling, it's better to have 500,000 people on the system, not 900,000. And again, that comes right back to the point of the cost of doing nothing. You've got a woodwork effect of potentially 40 to 50,000 Arkansans coming onto the Medicaid system with no reforms and no changes. That's if we do nothing. You've got a subsidy that kicks in for the over 100%. All that happens if we do nothing. There are drastic costs to doing nothing, including the $1.18 billion that's pulled out of Arkansas's economy in the form of Medicare cuts and tax increases that are here no matter what we decide to do. So you add all that together, we face a great opportunity, we face a great obstacle with instability in our healthcare system and therefore instability in our state budget. And that's what we have by doing nothing. Now, we've talked about the private option, and so I just kind of want to close, because I think I know that we're going to have the debate about a lot of the particulars during the debate, during the discussion part here. There's well-qualified people that understand the facts that I think are going to present the opportunity to debate the numbers. But I'll tell you kind of beyond the numbers, even though I think the numbers prove this is great for the state and the consumer, and I think with the opportunity for reform, it can be great for the federal government also. But that kind of leads to what I wanted to close on, and really what made up my mind for me, which is a lot more beyond the tangibles and the quantifiable facts that we deal with in terms of numbers and budgets and things like that, but also the big picture. And I can tell you that this is something that, if y'all know Senator Sanders very well, you know that he, I guess for lack of a better word, he probably reads and studies politics and policy more than probably most. And I think that it's important sometimes to step back and realize that we're not just dealing with the decisions that are right in front of us. We're trying to make decisions that set long-term consequences and implications. The policy that we pass today affects the policy that the person that assumes my seat in District 98 will make. It's all a building effect. It's momentum. We rely on the precedent of those that came before us. And so when trying to make up my mind on how I felt about this debate, the philosophical aspects of it I couldn't remove from, because they're perhaps the most important. And I think it kind of boils down to, I hope something that we could all agree on is that what we're doing isn't working. I just told you that doing nothing means we're going to have a Medicaid population of 900,000. We heard about a $400 million shortfall coming into this session. We face hundreds of millions of dollars in shortfall every year. We've got people who are incentivized not to make right decisions. They're incentivized to go on SSI. They're incentivized to go on disability, driving up the costs and expense of the federal government, but they do it to get health care. You've got people now with the system when it's based on percentages of FPLs the way it is. You've got people that make over the limits, but they're on things like RKids B. Or maybe they're on RKids A or B, but they don't want to report their accurate income because they lose a benefit. Or maybe they just don't want to get a raise or get a better job because they lose a benefit, and getting $1 more an hour costs them more than they can make up, because the entire system promotes wrong behavior. And I think that's been a system that's been building upon itself for decades and decades. And we have a chance to, in a very unique way, reform that. We have a chance to be unique and innovative in the way we approach health care, the way we reimburse providers, the way we incentivize the right behavior on the part of the consumer to access the health care network at the appropriate point in the most efficient way that saves the state and federal government money and makes sure that the consumer gets the better care that they need. So that's a lot more the big picture, but when trying to decide what the right thing would be from a budgetary standpoint, but also others, that's why I concluded that I was comfortable moving forward, because we're protecting our state from the instability of the federal government. We're protecting ourselves from the instability that will happen in our state budget because of the negative consequences of ACA. We're protecting the consumers who are going to be paying the penalties and the fines, and our businesses who are going to be paying the $38 million. We're protecting them by implementing this, all at the same time implementing reforms that I think will be unique and innovative and and give other states the opportunity eventually to model the way that we're approaching health care in the state of Arkansas. And all that means the state wins, the federal government wins, and the consumer wins, because they get better care. So with that, I'll be happy to answer any questions.